Hi, Allie.
Hi.
Okay, so just to start off our very first podcast ever, my name is Alyssa Ibarra, and I am one of the owners of Elysium. We do everything wellness that we can, so we do physical health care and mental health care and everything in between. This is going to be a conversation that we have regarding an upcoming workshop. So, Allie, go ahead and introduce yourself.
Sure. So, hello. I am Allie Szarko or Allison, and I have a PhD in behavioral science. So, you can also call me Dr. Allie. I am a gym member of Elysium, and I am about 5.5, 6 months pregnant right now.
A lot going on.
Yeah.
You've recently passed your dissertation, graduated. Go ahead and kind of tell me a little bit about that.
Yeah. I spent a long time in graduate school, and majority of the time that I was there, I worked at the UNR School of Medicine on an interdisciplinary research team, helping to weave in evidence-based strategies for medical students and healthcare professionals on burnout management, as well as implicit bias management. And then throughout that work that I was doing, as I was doing the rigorous research in academia, I also started doing community workshops, wellness-based community workshops that to get this information that we were teaching the medical students out to the general public about evidence-based practices for burnout, stress management, ways to deal with typical, very common symptoms of depression and anxiety, pretty much all the stuff that happens when you're human. We got good findings at the university, and then I started taking that information and doing these community-based workshops around the content. And right now, I also work for the Mayo Clinic as a client experience architect to help shape the experiences of a wide variety of healthcare providers.
So, when you started doing those groups to help with depression and burnout, what was that like for you?
It was really exciting. I think what interests me most with this type of work is taking it from a therapeutic context and putting it in a training context. So I often talk about how I'm not a clinical psychologist. When people come to the workshops, they're not going through therapy. We're not going to ask you about your childhood or have you go into the weeds of any experience, like heavy experiences. We really have, it's what I've enjoyed most about it is taking this content and transforming it into skills training. So it's the same way if you sign up to go to a Pilates class or a yoga class. The teacher, they're going to show you the postures, show you the positions, show you some modifications for your own needs, and maybe offer you some exercises you can then go and do on your own outside of the class to build those muscles. I take the same approach with these workshops of how do we take these traditionally therapeutic tools and turn them into skills training exercises that we could teach people so they can know how to manage their stress and manage their anxiety, but in a way that might feel a little safer for someone who maybe isn't ready to dive deep into therapy, but they are interested in, building resiliency and just taking care of their mental health.
Did you notice that there was a sort of relief that people felt knowing it wasn't therapy, that it was more of like a skills training?
Yeah, I do think, and also there's a lot of literature that supports this as well. But certain populations are more prone to seeking therapeutic treatment than others. So we know that, for instance, women are way more likely to seek out therapy than men might be, if we wanted to break things down into demographics. And also the career that someone is in may make them more prone or less prone to seeking out therapeutic services. One demographic is healthcare providers. Their identity is rooted in being the helper for everyone else. They might have a little more stigma towards themselves of, well, if I go and seek out therapy, what does that mean about me? Because I'm supposed to be out there helping everyone. or first responders have biases around seeking mental health treatment. There's different demographics who are more open to it than others. One, because I work in psychology, I almost feel like I'm surrounded by a lot of clinicians, and everyone is like, oh, I have a therapist, I have a life coach, I have a Reiki healer, I have I have my whole support team. So there are people who, they want all types of supports. And then on the other end of the spectrum, um, due to society, due to time constraints, due to the identities that we form, some people may just feel a little more comfortable in a training environment than they would feel in a therapeutic environment.
Being in the therapy field, it is the cultural norm. In fact, it's something that's encouraged and drilled into us. So you need your cuddle groups, you need your therapy, you need everything that's going to make sure that you have your needs met as well. And it was this understanding that, as therapists, we are the tool in our work, much like a surgeon needs sharp tools to do their job. We have to be the sharp ones. And so we have to care for ourselves to be able to be effective. And so it's really interesting with what you're talking about, because there is an entire huge portion of our world who's suffering, and they don't have that same encouragement. That's not drilled into them. That's not normalized.
Yeah, this is so we're doing a workshop at Elysium, and we've designed it to be rooted in acceptance and commitment training, which is a variation of acceptance and commitment therapy. And it's to do just that, to help people who maybe they're struggling a little bit with some symptoms of depression or some symptoms of anxiety, or they just feel like they're in a lull and they kind of need a mental reset with what the direction their life is going. The goal is to hopefully introduce them to these concepts, and then if they are like, yep, this is the boost that I need, thank you, they could be on their way. Or if they realize that they need additional supports, we can then also offer them, what would be the next step in terms of their care, whether that would be we could help connect them with the therapist or some other sort of resources in town that might suit their needs. So it's kind of like a open house for people who are curious and interested in mental health. And maybe they've been doing a lot of self-help work on their own, like listening to self-help podcasts, reading self-help audiobooks, but they want a little more in-person contact with trained mental health professionals without taking the full dive into having a therapeutic relationship with someone. Right. It's like that nice middle ground for someone.
Anybody who's not used to being in the therapy world, they don't exactly understand that there are a lot of different models to help them to improve their lives. So do you want to talk a little bit about acceptance and commitment training and kind of your background in it and what the foundations are?
Yeah, I think that's a great point. If you're not trained in the world of mental health from an outside vantage point, it can seem like it's all the same, but not every therapist is trained the exact same way, and not everyone is following the same protocols and procedures and underlying philosophies for how and why they do the work that they do. So with acceptance and commitment therapy or training, it is based in what's known as third wave cognitive behavioral therapy, or third wave CBT. And I say third wave because each wave of therapy is essentially a different generation of how we do things. So we talk a lot, about we have boomers and millennials and Gen Z, and everyone has a little bit of a different culture going on. It's similar with these waves of therapy. Like in the beginning of in Western society and American psychology, when we think about it, people were really into Freud. He was a really big deal back then. Now, Freudian analysis is more of like a small pocket of therapists who practice that. And it's mostly because psychology essentially branched out of philosophy. And as it's branched out of philosophy and turned into its own distinct field, it's been attempting to follow the same methods that other natural sciences follow. So as it's been evolving into its own science in and of itself, there's been more research that's come out to say, hey, that approach that we were doing, maybe it's not as effective. Maybe we should tweak it a little bit. What the third wave takes elements of behavioral therapy, elements of cognitive therapy, and some refreshed modern versions of both of them to create this third wave of cognitive behavioral therapy. So there's all these different approaches, but they're all rooted in the most modern science for those approaches. If you think about like healthcare providers, if you have a skin rash, you're going to want to go and see a dermatologist to get treatment. You might start by seeing your general family practitioner, but if they can't help you, they're going to refer you to go see a dermatologist. So it's the same way with therapy. The type of symptom or what you're dealing with, there's a specific therapist who can help you with that. And what I like about acceptance and commitment training in particular is it was rooted based off of this theory of relational frame theory, which is a theory of language and cognition. It was more rooted on what are the core components of languaging and thinking that lead to human suffering, and what's the secret sauce to help people suffer less. So regardless of if they're diagnosed with anxiety, depression, PTSD, etc., what are the elements of the languaging that they're having with themselves and others that's leading to suffering, and how can we help them be a little more flexible and a little more pragmatic with how they're using language to increase their vitality in life.
A lot of times I'll be working with a client and we'll do all this skill building and we'll really get to the root of a lot of things. We do so much work together, and then it reaches a point where we realize, okay, there's a sort of limitation we're reaching. There's somewhere we're trying to be, and EMDR might be the next step of how to get there. And so to be able to get to do the EMDR, though, they need to be able to use certain skills, learn how to regulate themselves. So that's one thing I love about ACT is it is something that widespread can help people because it's so skills based. It really speaks to a person's humanity, and then recognize, okay, what are other limitations I'm trying to push past? What other resources can I do? But I think it's helpful for people to know that because we're not taught how to do therapy.
I think that's a great point of, it's not that it's a panacea for everything, but it gives you a good foundation to build upon so you can go deeper with whatever approach that you need.
I want to ask, just because some people have experienced ACT and some people have no clue what this is, and so it's hard to kind of enter into a workshop and not totally understand what it is. What would be an example of an acceptance and commitment training skill that somebody might?
So with ACT, there are, in the literature, they talk about them as 6 core processes, but in plain English, 6 different skills that we teach. And I like to use that analogy of going to the gym. So, you go to the gym and you might have arm day, and then the next day you have leg day, and then after that you work on your core. But you want to be working on all of those skills. We try to teach all 6 skills because we want people to have a well-rounded skill set, essentially, for how to build those psychological muscles so they can come into contact with all different stressors in life, and they have the skills and they've been working their psychological muscles so they know how to deal with it. And those 6 skills that we teach are values clarification, committed action, present moment awareness, perspective taking, cognitive diffusion, and acceptance. So we break it down in this 4-part series. We're trying to target about 2 skills per class, and then wrap it all up together cohesively in the end. What I like to do personally with ACT trainings, especially in a group context, is I always like to start with values and values clarification, which is that skill of knowing in a particular context what's most important to you in that context. So we're in the holiday season right now, and it wasn't very long ago that I was a student, and I remember having kind of these moments of values conflict where all these holiday parties are happening, and yet I also have my final exams happening at the same time. So being put in that position of, do I go to the holiday party tonight and not sit and study for this exam? Or do I sit and study for this exam and instead of going to the holiday party. And a question like that really comes down to assessing for you in that moment, in that context, what's most important to you. And if you realize that you haven't seen your family or friends for the past 4 or 5 months because you've been so in the weeds with school and it's really tugging at your heart, that might be an indication that maybe your family and friends, maybe that's just more important than getting a perfect score on your test that you know you're probably already going to get an A in that class anyway. So we start with values clarification, and there's a bunch of different exercises that we would do to teach someone values clarification. And again, it's the same with going to the gym. If you want to work, it's harder for me with the baby in the way, but if you want to work on your core, well, actually, it might be a good example of, when I was in a different context, when I wasn't pregnant, I could do sit-ups, I could do all sorts of core exercises, and it felt great. But now that the context has changed, I've had to modify the approach, and one core exercise that works for someone else might not work for me right now. So I have to adapt and find the right core exercise that works for me in the situation that I'm in. It's the same way with these exercises that we're going to teach in the course. I'll walk people through lots of different ways to come into contact with their values. And for one person in the room, they might love doing a particular exercise on their values. And for another, they might like a modified version of that, or they might like a totally different exercise. But all of those exercises are still targeting that values clarification skill. Mm-hmm. So we'll talk about what the core skill is of those 6 during each class, and then we will actually experience a whole bunch of different exercises related to that skill. And then the participant, when you go through the workshop, you can identify like, hey, this exercise really worked for me, or that exercise really worked for me, or hey, I like this, but can you give me a modification so it can apply a little more to what I'm dealing with? And that's the nice thing about having a trainer in the room with you, is we can find the perfect exercise for you.
I think it can be so tricky because especially now, since we've seen such a shift in people wanting to do the self-help sort of resources and wanting to improve themselves, which is beautiful to see. But because that's been such a shift, I think there are so many resources out there now and so many books and so many approaches and so many opinions that I see a lot of people get really overwhelmed, where it's like they don't know where to start or they don't know what to apply. So this is nice because with a trainer in the room, it gets to feel more personalized and you can kind of help them navigate what is something that fits for them.
What I'm really excited about for this workshop that we have coming up is we're capping it to 10 to 12 participants max to keep it small, and to have that same small group participate in each class along the way to build, a culture of safety among each other while we're going through the content. And it'll be small enough that there'll be time during each class to go into that customization and to have those conversations of where is everyone at with their self-care mental health journey, what's been working for you, what hasn't been working for you, and how can we help provide context, explanation. Like I said at the beginning, not all therapists are the same. Not everyone is using evidence-based strategies. Sometimes, you have to be cautious with the information that's being spread online of, is this evidence-based? Or sometimes I'll see content being put out there for the sake of, getting more people to your page because it's like really good clickbait, but then it's not backed by science at all. And in some cases, it can be even harmful and not beneficial to the consumer.
I imagine people get pretty discouraged if they see one of those pop psychology tricks and then maybe it works once and then nothing changes. When you have a workshop like this, it creates more sustainable changes. The act, it's nothing that is just pulled out of thin air. It's stuff that has been shown with long-term success for people if they're consistently applying it. And so I think that's one of the biggest things that people kind of need to hear about this too, is this is something that is not going to be a short-term fix. These are long-term things we're talking about.
Yeah, it goes back to going to the gym, right? It's like, unfortunately, I can't just do crunches one time and have 6-pack abs. I can't just eat an apple one time and say, I've done it, I've conquered nutrition. They're these ongoing practices. It's a practice. It's this ongoing practice that you get better and better at the longer that you're doing it. And there's like that saying of if you practice something for 10,000 hours or more, you're an expert. So it takes time to get really sharp with your psychological flexibility skills, which is the skill that ACT is trying to teach us. And I've been studying ACT and practicing ACT personally for over a decade now. And there's still times when I get rigidly hooked to a thought. I still have intrusive thoughts. I still suffer. I still feel the full spectrum of emotion. This approach isn't about teaching people how to feel good all the time and never contact pain again.
Right.
It's teaching you, when you do come into contact with pain, how can you show up and hold it in a healthy way and continue to move in the direction of your values, even in the presence of those pain points in life. And the more that you practice, the more agile and quicker you get at holding space and continuing to pivot and move in the direction of your values. But it is clunky at first, that first time you go back to the gym after not going for months and months, and it feels embarrassing.
It's rough.
It's rough. But if you keep practicing, you're going to get better and better at doing it.
I remember my therapist a long time ago describing kind of the imagery of jumping tracks. And that always helped. It was like, you've practiced one thing for so long, you've thought one way for so long, that eventually, if you practice enough, you jump tracks and that becomes your automatic. But it's not going to be after the first several times that you're practicing something. But I notice a lot of people get really discouraged.
And that's a great point. One element of ACT, one of the skills that we hone in on is mindfulness, which is present moment contact, which is essentially noticing like I hear now, noticing myself in the present, in the now. And we also teach perspective taking, which is this ability to kind of take like a bird's eye view of the situation, step outside of yourself and view yourself in the context. It's this really meta way of viewing the world, also rooted in traditional mindfulness practices. But the more you hone in on that skill, the easier it is to identify when you've jumped tracks or when you've fallen back into those old behaviors. And when you've fallen into those old behaviors, if you're practicing those mindfulness skills, the moment you notice it, like, oh, I've fallen into this old behavior, if you have all the other tools in ACT, you can say, okay, I've fallen back into, not even back, but I've just fallen into this old pattern of behavior. But now I have these tools to jump back onto the track that I want to be on.
Something I noticed when you talk about ACT and certain skills is you say it with so much compassion. It's kind of like no matter how a person shows up or what response they have to their pain or challenge, there's so much compassion and it's okay. Let's bring it back and let's, come back to ourselves to do the skill. Is that something that's really foundational? Is that something that's taught with the skills?
I know a handful of psychologists that would describe ACT as a compassionate approach to healing. That's rooted in, again, Buddhist philosophy, which is that suffering is an inevitable part of being a human. So there's nothing wrong with feeling suffering. There's nothing wrong with feeling pain. It actually just means that you're a human. And if we start from that base of there is nothing wrong with feeling pain or suffering, then we have room to grow and learn how to have our pain and have our suffering without it having us. We can learn how to move in the direction of things that are important to us without getting so caught up in trying to get the pain or the suffering to go away. And it's this weird paradoxical effect with ACT, which is the more you learn to kind of surrender and accept that pain and suffering is a part of being a human. So I might as well get moving in the direction of my values. The more you start to do that, the more the pain and suffering kind of subside and they're no longer like the main thing you're fixated on. They're just another, like a metaphor in ACT is passengers on the bus. Like it's just another passenger on the bus as I'm driving towards what's important to me.
After a workshop like this, do you see a transition of a person's self-compassion because this is so integrated in the foundations of it?
When we can get people to let go of this illusion of control, of trying to control the uncontrollable, which is the fact that you're human, you're going to feel pain, you're going to feel suffering. The moment we can show someone in a very compassionate way that is a part of the entire human experience, I do see the sense of relief of like, okay, so there wasn't anything wrong with me to begin with. Yes. But then they might say, but Allie, what do I do though when I'm like really stuck in the pit? Some people might get it immediately. Others, like you've mentioned earlier, others need to go out into the world and experience the exercises when the pain and suffering is happening in real time. It is this experiential approach. What we're hoping will happen is we'll introduce some concepts, and then people will have a full week to go out and practice in real time. And then they can come back to the next class and say, well, this was my pain and this was my suffering this week, and I tried these skills. And this worked and this didn't. And then we can tweak it and modify it again, add some additional skills to their tool belt. Then they go out the following week, and then we do that 2 more times. And so hopefully the goal is by the end of the 4 weeks, they've gotten enough feedback and coaching from myself that they feel they have a better understanding of when their particular pain and their particular suffering pops up, which exercises to use, when, and why.
That's what I love about this model is it creates movement for people. Because I think a lot of times people give up on self-growth because there's a sort of stuckness or a wall that they hit. And so it's like, yeah, you might go out and try a skill and it might feel like it's failing. But if you have even just the 1% different feedback from the situation because you tried a new skill, and then you have loving people who can give feedback on how to do it differently, I think it's the wiggle room a lot of us need to be able to feel encouraged to keep going forward.
Yeah, we're hoping that this workshop, it's again like riding a bike. Instead of throwing someone on a bike and saying, go, we're hoping that this workshop will be essentially like the training wheels that someone will need, where we'll go through the foundations and the mechanics of how to ride a bike. When they're taking the class with us, we'll practice, and then they'll go off and be kind of awkward in their own practice and then come back. But by the end of the training, that we can either help them take the training wheels off or help them find more resources to keep the training wheels on.
So I'm going to pivot a little bit, and I want to talk more about the practical parts of this workshop. What you're offering as far as price point is something that I think is worth talking about. So do you want to kind of describe a little bit about price point and why you decided on what you did?
Sure. So the workshop, if you are a member of Elysium, it'll be $100, and that is including all 4 classes. So it's not $100 per class, it's for the whole package, for the whole entire series. If you're not a member, then it'll be $120. And the reason that we decided to go with that price point is, I mean, even if you're not a member and you're paying $120 to attend 4 classes, that's still less than the cost of seeing a therapist even one time with the modern out-of-pocket price points for getting access to a therapist. And that was important for us to keep it relatively low because we want it to be accessible. Again, this would be a great workshop for someone who maybe they're interested in therapy, but they're not quite sure where to go, or maybe they just want to get some foundations. Maybe they are going to therapy and they just want a little extra support and a couple other perspectives of how to do things. Or maybe they're a self-care enthusiast and they just love all things self-care and they just want to take the workshop because it sounds fun. We didn't want the price to be an obstacle for someone. And so when you divide the 4 classes by those price points, I mean, that's comparable to how much people pay to go to a yoga class. We didn't want it to be at such a high price that someone was deciding, well, can I pay groceries this week, or am I going to be able to afford my gas? And we didn't want it to get in the way of those really foundational elements of someone's mental health, those social determinants of health. We know that if you're struggling to have a roof over your head, to get access to nutritious, healthy food, to get to your job. If you can't pay for those things, then raking the price up for this workshop isn't going to help.
No,
it's not going to
it
help.
can make it worse.
It's probably just going to make it worse. So those were really the factors that we were taking into consideration with this. Is, can we provide an offering to the community that isn't going to break the bank for them to come into contact with really good science about mental health?
I really appreciate that, because I know we've talked before, but there's so many different things out there like workshops, and they're all so valuable. So this doesn't devalue that at all. But I know a lot of people wish so badly they could access that care, and they just can't. And so mental health is not accessible to a lot of people. It's a major problem. And so that's something I've always appreciated about you, is you just want it to be accessible to as many people as possible.
Thank you.
So I am curious, because there are so many different approaches to mental health, and you have a passion for ACT. How did you first come in contact with ACT, and how did this become your life's work?
That's a great question. I've been studying and practicing ACT for over a decade now, and I came into contact with it when I was in my early 20s. And I think, similar to a lot of people that go into the mental health field, I was kind of struggling and having a hard time figuring out myself and my own emotions, and why I would feel things, and why other people would interact the way that they did. So I started my career working with adults with developmental disabilities and intellectual disabilities, and then I did some work working with children that had autism on the spectrum, and that work was interesting to me, and it was really rewarding. I was now they're called RBTs, which is like a registered behavioral technician. So I worked doing behavioral therapy with those populations, and felt really rewarding. I was always more curious about the parents of those individuals, or the caregivers of those individuals, and how they were dealing with these aspects of life, while I was simultaneously suffering and trying to figure out how to be a human in your young 20s. You leave your family home, and you're out there in the world, and it feels so raw and tender, and you're messing up. And through my undergraduate studies in the behavior analysis program at UNR, I stumbled upon Steve Hayes, who is a co-founder of acceptance and commitment therapy. And I was very nerdy, where I just would ask, as an undergraduate, I would ask professors if I could sit in on their labs and just help their graduate students do research. And I had heard a little bit about ACT, and I was like, this sounds interesting. It's not so much working with the population I'm used to, and this guy seems to be a big deal, and I don't know why, but I wanna figure out what's going on. So I started, when I was an undergrad, I was a research assistant in his lab, helping his graduate students work on projects related to acceptance and commitment therapy, which led me to volunteering for a couple ACT boot camps in town, which were these boot camps designed for master's level clinicians to get 4 days of intense exposure of acceptance and commitment therapy. And I would be sitting in these workshops in the background, helping people register for the event, but I'd be watching these really profound professors and clinicians standing on stage talking about ACT. And I just remember having all these aha moments of wow, that's how I feel, and that I'm dealing with the same things that all of these people in this room are dealing with. I'm dealing with the same pain and suffering that everyone in this room is dealing with right now. And they were just these really powerful, moving workshops that I got to be literally like a fly on the wall in. And I picked up a copy of Get Out of Your Mind and Into Your Life, which is one of Dr. Hayes's best known self-help books. And I continued to hover around him, and I continued to hover around a bunch of people studying ACT. And then I met my graduate advisor, who advised me through my master's degree and my PhD, who was a student of Steve's, Dr. Homenfar, and she got me even more immersed into it. And the more that I say I practice it and I teach it, the more that I continue to practice it with myself, the larger my world got around me, the easier it was for me to deal with my own symptoms of anxiety, for my own symptoms of depression, and all the things that I would do to self-soothe that weren't healthy for me. And it's just been this experience where I've seen it work for me firsthand. And that has also led to why I'm so passionate about sharing this information with others. And I've seen it help medical students. I've seen it help my friends. I've seen it help my family in real time. And I'm really bought in because not only have I like very viscerally felt the impact of it in my personal life, but I'm also a scientist, and there's like this huge body of literature that supports it.
Yeah, and it's like when you feel the growth yourself and the application, it's hard not to be so passionate and want to just shout it to the whole world, like everyone needs to try this. The fact that there are so many skills involved in it means literally anybody could have access to it. Anybody could benefit from this, but it's just not something that is out there enough. So that's your goal, I guess, is to spread that out so more people can experience what you have.
Even if someone attends the workshop and they leave with one or two really, transformative, useful skills, it's going to feel like it was a value for me personally. Like I accomplished what I wanted to accomplish, and when I say useful skill, I mean a skill that helps someone deal with their own pain and suffering. Even if just going through this 4-week course, someone leaves and they have a couple aha moments about how they're living their life, and they have a couple more skills for how to navigate the very human experience of pain and suffering, then I feel like we've done our job.
Absolutely. And also on a personal level, there are a few things more satisfying than watching a person have that aha moment and to see that there's even just one thing that now can change thousands of interactions that they have.
That's also what keeps me going is not only do I see it work with myself when I apply it, but when I've spent time with people and taught them the skills of ACT, and again, maybe in the moment they don't feel the impact, but then they reach out to me 2 months later, 6 months later, a year later, and they say, wow, Allie, that skill that you taught me, it has really, really helped me. I really loved when I got to work at the medical school because I got to spend a lot of time with medical students who were in the pits of really heavy stressors of being a medical student. And one of the students that I worked with, she went on to do her residency in surgery. And being in surgery, it's one of the most competitive, it's one of the most grueling residencies that someone could be in. One day she was like 2 or 3 years into her residency program, and one day she called me just to tell me like, hey, that stuff you taught me in medical school, at first I didn't really think it was that applicable, but oh my God, now that I'm in my full-blown residency, it is helping so much. And just to tell me thank you, and just to know that like that's one more surgeon out there that can manage their stress and well-being a little better, to the point where they can now have a little more compassion and hold a little more space for the patients that they see. That's the icing on the cake. Like that's super rewarding for me.
That's what gets you up in the morning. To close up this conversation, what do you think people need to know to prepare for coming into this workshop?
Yeah, so I would say if this sounds appealing, if you're interested, first thing is obviously sign up. Contact Elysium and sign up for the workshop. And once you've done that and you're on the list, I always recommend bringing a notebook and a pencil or something to write with, so you can take notes, and an open mind. And you can dress cozy for the winter time. It's going to be super chill. We'll have handouts. We'll have worksheets and handouts during each class or meeting, and it's going to be pretty low tech. Like we're not going to be you don't need a laptop. We won't be using a projector. We'll be sitting around in a circle talking about these skills. I might draw some stuff on a board, but yeah, just yourself, an open mind, and maybe a notebook and something to write with.
The one thing I always like to throw out there too, especially when it comes to group work, is it can be really nerve-wracking coming into a group setting. People have varying levels of vulnerability they're willing to bring into a group. And I think it's important for people to know that all of that's okay. Even if you just show up and listen, that is incredible. Or if you really want to participate, that's also incredible. So I think knowing that you have full autonomy and this gets to be however you want it to be is important.
Yeah, absolutely. Like I said, we're not going to be asking anyone to disclose any information about themselves that they don't feel comfortable sharing. It's totally up to the people in the room how much or how little they want to share. There's no expectations to share at all. If you're just more of an introverted, quiet person and you just want to sit and observe and listen the whole time, that's totally fine. If you learn better by kind of talking, that's fine too. And what we're going to do in terms of being facilitators is we're going to hold space for everyone to make sure that the lessons are being taught, we're getting through the exercises, but that everyone has the ability to learn in the way that works best for them.
Just as kind of a thing to add in here, as you know, the owner and seeing kind of how people have interacted. Sometimes people sign up for the mental health portion and they don't realize that we're a blended space and our front desk is in the gym. So people will show up and they're like, I don't know that I'm in the right spot. I'm trying to go to this group. And they look around at the gym confused. And so that's going to be a part of it, watching at the gym when you show up. And we'll make sure that once you check in, everything is just smooth and we'll bring you up to the cozy space where we won't make you work out, just your mind.
Yeah, we'll be doing mental exercises.
Yes, that's it.
But you can dress cozy and comfy. You don't have to be wearing workout gear. And one thing that I love about coming to the gym and just coming to the space is oftentimes you're greeted with 2 cute doggos at the front desk as well. Yeah. So if you go to the gym and there's the cute dogs in the front, you've made it to the right place.
Yeah, and if you're even mildly anxious about coming into this workshop, at least they'll help soothe you, and you are welcome to pet them at any time. Okay, I really appreciated this conversation. I have loved getting to know you ever since however long it's been. I think about 6 months now, and I think you're incredibly knowledgeable, and you're a wonderful resource in this community. So I am looking forward to this workshop. I hope that it's the first of many. I have a feeling it's going to be something that's going to be helpful for a lot of people over time. So thank you for being here. We're going to see how it goes.
Great, thank you. And thank you for opening Elysium and just having this merged mind, body, spirit space for us to work on the whole aspects of our health.
My pleasure.